Okay, so this is a $40,000 implant, the most expensive erectile dysfunction treatment in the United States of America. And today, we're comparing it to a $1 at-home remedy and everything in between there. We'll break down the science behind each treatment, including its pros and cons, and then we'll discuss when each one is going to be most effective. By the end, you'll know exactly where every option stands, not just in cost, but in real effectiveness. So, like the video, subscribe to the channel if you want more of this amazing information, and let's get started. Okay, first we'll talk about the free or nearly free options, because I always recommend starting with the simplest and the most effective options, especially if you're in the early stages of ED. First, movement of any type, cardio, running, swimming, brisk walking. All of these exercises improve blood vessel function, which leads to better blood flow everywhere. And in fact, strength training boosts testosterone levels and strengthens muscles, including the pelvic floor muscles. This not only helps with erections, but also improves overall health, like heart health, blood pressure, and metabolism. So of course, you can do workouts at home or at an outdoor sports area. There's really no need to go to a gym. That's why this boost in erectile health is free. There are no downsides. You just need discipline and consistency, and you'll start seeing results in just a few weeks. Second, pelvic floor strengthening or Kegel exercises. I call them dick-ups. Many men think Kegels are just for women, but that's just not true. By strengthening the pelvic floor muscles, you're actually improving your control over your erections and their duration. Listen, you can do them at home, you can do them in the car, you can do them in bed, at work, and no one will ever even notice the benefits. It's free, it's safe, and it's effective over time. There are no downsides. So to see exactly how to do them, check out this video right here. Third, eat foods rich in nitrates. Now, nitrates are going to increase the production of nitric oxide, which is a substance that dilates blood vessels and improves blood flow. It's essential for a strong and stable erection. Nitrate-rich foods include watermelon, beets, spinach, arugula, celery, radishes. Listen, they're inexpensive, they're tasty, you can grow them in your own backyard, and they're beneficial not just for erections, but also that heart health, blood pressure, and metabolism. And they don't require a prescription, and they help fix things. But I want to preface, don't expect a glass of beet juice to make the difference. You know, you need a cumulative effect over time. So integrate nitrate-rich foods into your diet daily. If that's too hard, use my E-Function Smoothie recipes to help. Now, you know my channel is all about natural ways to treat ED and men's health. And natural foods have been proven to be incredibly effective. They were the original medicine. That's why I want to remind you about the success men have had with my E-Function Smoothie Recipe Book 2.0. It's packed with 11 of my original erection smoothie recipes designed to help keep your erection strong and healthy. Listen, look at this. Billy, who struggled before drinking my E-Function smoothies, recently said that after drinking them for a couple days, that his goal was, look at this, stretching my sweatpants. Now listen, each recipe uses clinically proven ingredients that help boost nitric oxide, reduce inflammation, and naturally improve blood flow. I've dropped the link in the description below, so grab your copy today. No point in waiting. And fourth, mouth tape for sleeping. I know it sounds strange, but when you sleep with your mouth open, even if it's just cracked, whether you snore or not, it actually is going to lower your blood oxygen levels and worsen blood vessel function. But when you breathe through your nose, it allows for high levels of nitric oxide to be produced and then stored within the sinus cavity. This boost of nitric oxide through mouth taping will cost you no more than $10 to $20. The benefits: better sleep, higher levels of nitric oxide, improved breathing, improved blood flow everywhere in your body, and even healthier teeth. Now, the downside is basically that it feels unusual at first, it looks kind of funny, and that you need to consult your doctor if you have sleep apnea. Now, these solutions are quick, they're easy, and they're all related to lifestyle. Now, lack of physical activity, you move more. Stressed out, minimize stress. Poor diet, change it. Smoking, stop smoking. These are safe and cost next to nothing and come with a bonus. Not only will they help with erectile health, These two will also help you improve overall health. And believe me, this is exactly where you need to start. Now, let's move on to the next category, inexpensive but more targeted solutions. These usually cost anywhere between $30 and $100, and these methods are suitable for men whose ED isn't caused by severe organic damage, but rather more blood flow issues or psycho-emotional factors. First, tension rings, aka cock rings. Now, this is a simple mechanical device worn at the base of the penis, either in the front or wrapped around the testicles to trap blood and maintain an erection. Now, these range in price from $30 to $60 depending on the material. Now, the pros of using them: you're going to have instant stiffness, no more medication required, and they can be decorative. Cock rings can also be used together with other methods, and they're super easy to use. Cons, you got to get an erection first in order for it to work. They shouldn't be used for more than 30 minutes, and otherwise they can damage the tissue. And then it doesn't treat the underlying cause of ED. It only really helps during intercourse. And then, of course, some men find it uncomfortable or awkward at first. Next, Viagra and Cialis and their generic equivalents like the chews and the honey packs, etc. Now, I'm a functional medicine physician, so I believe fully in fixing the root cause and using all natural methods when you can. But I want you to be aware of all of your options, so I've included them here for general reference. Now, these are medications that increase blood flow to the penile tissue, and they roughly cost anywhere from $50 to $100 per prescription. The pros: they work quickly. Viagra takes effect in about 30 to 60 minutes, while Cialis is milder but lasts longer in the body. It lasts up to 36 hours of proven effectiveness. Another thing is that these are supported by numerous clinical studies, usually funded by the companies. But the cons is that it doesn't work for everybody, and that they have possible side effects like headache, facial flushing, stuffy nose, reflux, vision changes, and even blindness. And you should not take it if you're on heart medication or even have blood pressure issues. So you always want to consult your healthcare provider before taking any of them. And I can say that this isn't a cure. It's really just masking symptoms with these pills. Now, let's move on to a more expensive method. It's often used when pills are contraindicated, when other solutions don't work, men with diabetes, or men who've had prostate surgery, or men who want to put the time in to exercise and make things better. It's a method that I'm talking about that's called the penis pump, a vacuum erection device. Now, it creates a vacuum around the penile tissue, which draws blood into it and produces an erection. Now, after that, a tension ring or cock ring is often used to kind of keep the blood in place. Now, this can be used over time to help rehabilitate an erection, or used in the moment to pump it up to have immediate intercourse. Now, the prices range anywhere from $100 to $500, depending on whether or not they're trying to charge your insurance or not, right? So the pros: that it's suitable even for men with severe erectile dysfunction. No pills or injections are required, and it can be used if you have diabetes or heart conditions or other situations where pills aren't an option. The cons: you cannot use it if you have a bleeding disorder like sickle cell. Another one is that men find it embarrassing to use, and some men really don't like the sensation of, quote, an artificial erection, because the erection ends up being more like a fullness and not necessarily a stiffness. Another one is that it needs to be used regularly in the form of an exercise program like my P3 program in order for you to see any really long-term benefits. Next, let's talk shockwave. Now, how do acoustic waves of a specific frequency work? Well, they're directed at the tissue of the penis, and these micro vibrations create tiny cavitations in the tissue that then stimulates the formation of new blood vessels and improved blood flow and healthier tissue. This method is used for vascular ED when the problem lies in blood flow. I always tell my patients, this method is worth considering if you've been diagnosed with vascular ED. You've tried simpler and cheaper options, they didn't work, or you just want to increase the edge. See, shockwave therapy won't work if the problem is hormonal or psychological. When it comes to erectile dysfunction, its effectiveness is still really debated within the medical community, but studies show mixed results. So you got to understand that it's not a magic fix, but rather a tool in the arsenal that can help a certain group of men through to some results. It won't work for everyone. So a typical course includes 6 to 12 sessions. The cost per session is about $300 to $500. So that's anywhere between $1,800 and $6,000 for the full course. Next, let's talk about procedures that cost thousands of dollars and are offered by private clinics. Injections into the penile tissue. Now, there are two main options. The first is PRP therapy, known as commonly sometimes as the P-shot. A small amount of blood is drawn, then placed into a centrifuge and spun out to separate out the platelet-rich plasma. This plasma contains growth factors that in theory can stimulate tissue regeneration and improve blood flow. So the patient's own plasma is then injected directly into the tissues of the penis. The cost is anywhere from $1,000 to $3,000 per procedure, and typically 1 to 2 procedures are done over time, spread out between a month or so. And sometimes follow-up is recommended a few months later if the results aren't seen as sufficient. In total, the course can cost you anywhere between $2,000 to $10,000. Now, this method is used for mild to moderate ED, often in combination with pumping and shock wave therapy. The shock wave therapy we discussed earlier and pumping we discussed earlier. Now, the cons is that it's pretty expensive and that you're using your own body to heal, and sometimes it may not do much. Some complain of the pain, and you may need to repeat the procedure after 4 to 6 months. Now, the second option in this price range are Botox injections. Yes, the same botulism toxin most often used in cosmetic procedures. In this case, it's used to relax blood vessels within the smooth muscle tissue of the penis in order to immediately increase blood flow to the erection. Now, the cost is $1,000 to $2,000 per procedure. The effect lasts anywhere from 3 to 6 months, so repeat treatments are definitely needed to maintain results over the years. And over a year can add up $3,000 to $6,000, and the cons is that it's temporarily effective, that there's very limited research specifically for ED, and the side effects could be temporary bruising, asymmetry, numbness. The next erectile dysfunction treatment is testosterone replacement therapy. Now, testosterone is prescribed only if lab tests confirm that a man's levels are truly below where they should be, and he has the corresponding symptoms such as reduced sex drive, erectile problems, chronic fatigue, low energy, and loss of muscle mass. These cost anywhere from $200 to $500 per month, depending on the form of medication used. Annually, that's about $2,400 to $6,000, plus the cost of lab tests and doctors' consultations to interpret them. So the pros is that testosterone can make you feel better mentally and physically. It can even help with some of your chronic diseases. It increases energy, stamina, and mood, improves body composition, more muscle, less fat. The cons is that it is not a magic fix for ED, and it won't fix the problem if ED is caused by vascular or psychological factors. It's not magic, and it requires ongoing lab monitoring. You got to manage your testosterone, estrogen, hemoglobin, PSA even. It's a long-term therapy, and if you stop, those testosterone levels go back to baseline if you haven't addressed the root cause of the decline of testosterone in the first place. Now, the most radical and most expensive erectile dysfunction treatment is the penile implant. This is a surgical procedure in which a special device is implanted into the penis, allowing the patient to achieve and maintain an erection at any time with a push of the button. Now, there are two main types of implants. There's the malleable or flexible, which is kind of outdated now. It consists of 2 semi-rigid rods that remain in a semi-erect state, and then you just bend it, straighten it down. Next, there's an inflatable one that's more modern and complex. These cylinders are placed inside the penis, and a small pump is implanted in the scrotum, and a fluid reservoir is placed in the abdominal cavity. So when you press the pump, it transfers fluid into the cylinders, creating an erection, or air, creating an erection. And after intercourse, the fluid can be released back into the reservoir. See, this surgery is performed in cases of extreme ED that does not respond to other treatments. And so I always suggest to exhaust all options first personally because this costs anywhere between $15,000 to $40,000. But the good news is that 90% of patients that have been recently surveyed say that they are satisfied with the results. But these surveys are done by the same doctors and companies doing the procedures. So instead of getting to the point where you have severe ED, go ahead and eat these 3 foods that I talk about in this video. Work them into your routine and you will see a difference in your erectile dysfunction right here.